Well, just to introduce myself, my name is Dimitris Tsitsikas. I'm a hematology consultant looking after sickle cell and thalassemia at Homerton Hospital in London. And I had a similar meeting with patients of City and Hackney a few days ago, so I will say what I am not. I am not a virologist, I'm not a public health physician, and I'm not a general practitioner, a GP. So I will not be able to answer every question, but I hopefully be able to answer most, or at least point towards the right direction. So that's all from me.
And I have to say,
let's start with the questions.
Of the service at Homerton Hospital, he's really the head person who's really, really dynamic. But anyway, so the first question is, how safe are the new vaccines?
So the answer is they're pretty safe. So as you know, all three vaccines licensed for use in the UK, the Astrazeneca or Oxford, that are clinical trials with thousands, tens of thousands of participants, and they all are pretty safe for minor side effects, which I think is your next question probably, that more or less all vaccines have. Otherwise, I can hear you.
Okay, yeah, so it was frozen across all of our screens.
Okay. So yeah, as far as the safety is concerned, as I said, all three are pretty safe, and there is pretty robust evidence for that.
And I think one of the questions was, so most of our patients got Pfizer or the Oxford AstraZeneca. Did you hear from different patients about different side effects they got? Some people got a bit of symptoms after, like chills. Is this common? Is this something they should look for?
They are very common. So after each, and the same applies to pretty much all vaccines. For the first 24, 48 hours, usually, it can be up to a week, but a week is quite uncommon. It's usually the first 24 to 48 hours that you can feel unwell. You can feel flu-y, basically. You can have flu-like symptoms. You can have chills, you can have a low-grade fever, feel tired, get a headache, have a sore arm at the site of the injection, but nothing that paracetamol cannot help with. And then generally everything subsides and people go back to normal. Okay. Essentially, it's not that different from having the flu jab. It's the same sort of symptoms.
And someone asked, have you heard of any patients with thalassemia that's reacted badly to receiving the vaccine?
I haven't, and there hasn't been anything published, certainly, that any severe reactions for thalassemia patients or sickle cell as well, because I look after both, have been documented. So no, okay. There's no evidence that thalassemia patients get any severe reactions. It's the same mild side effects the day or the day 2 days after.
Okay. And we've gotten a lot of questions about this. People are worried, and they asked, are they going to mix and match the vaccines? And if so, has there been any safety and efficacy data on this?
So there is something that they might try to do, that to give first dose of one vaccine and the second dose of another. It hasn't happened yet. When it comes to, there are assumptions and one should assume, but the assumption is that if you give two safe things, they will still be safe. As far as the efficacy, we don't know. But if and when that will be very closely, actually will add in itself. And because everything is new. The vaccine is new, the disease is new. We are all in one way. We have very robust data. But what else last for that is more. Did that answer the question?
So what happened is that we lost you for a lot of it. The internet seems to be, I don't know if it's just me.
Oh, did you?
Yeah, so we heard something. So I think
no, it's probably me. I had the same problem before. So let me just say it again. So what I was saying is that the mix and match has not happened yet. I know that there is some thinking about doing it.
Mm-hmm.
There are no safety efficacy data as yet, but it's going to be, if and when it happens, it will be monitored very closely.
Okay. How worried should we be about the South African variant, and in particular the effectiveness of the Astrazeneca vaccine that we've been seeing on the media?
So that's a very valid question. Of course, it's a concern. And as you said, the Astrazeneca, there is concern that the Astrazeneca specifically may not be as effective, even though a lot more information is being gathered on a day-to-day basis. Having said all that, there isn't much we can do about it. So it's something that will be monitored. And as far as I know, the AstraZeneca vaccine, they're still trying to tweak with the vaccines. And all pharmaceuticals and all labs will continue tweaking with the vaccines as we see more variants emerging. But the South African variant is certainly a concern. We just cannot do anything about it.
And I think it's important that patients and their families do not become complacent and think that
correct.
Yeah, that they can, they have the vaccine now so that they could potentially go out and do things as normal. I think you still have to be very, very careful.
Yes, and that is not only because of the South African variant, it applies in general, because one, there are so many things we don't know yet. We don't know if we can still pass it on, even if we're vaccinated and we don't get ill ourselves. It's possible that we can still pass it on to others. So what we have to see when it comes to our fight as a society, if you like, against the pandemic, vaccination is possibly the biggest part of it, but not the only. So the rules of social distancing, of minimizing contacts, minimizing exposure still apply. It's certainly not the case that you get vaccinated and then you can go back to normal. Hopefully soon we get there.
And this question is quite similar. Does the vaccine protect against all strains of the virus?
Especially the UK one, the Kent one. There is a concern about the South African, but generally speaking, they are all pretty much as effective towards all the strains we know.
Okay. How much protection do I have from the single jab? I'm concerned about the efficacy of the vaccine after the 12-week wait for the second dose. I think this has more to do with the Pfizer.
After repeating what I said at the beginning, that I'm not a virologist, well, that has to, no, it's quite important. The evidence is that we do get substantial protection with one dose, with the first dose. What substantial means is out for interpretation. There will be people who quote different percentages. I'm not going to go there, but there is some protection, and the gap that has increased in a way. We have to bear in mind that the availability of the vaccine is finite. And actually, the UK were doing quite well. We have managed to give the first dose of the vaccine almost to 20% of the population, if not more. But it has been a balance between trying to get as many people vaccinated with the first dose to have some protection instead of vaccinating everyone fully first, keeping the right sort of gaps, if you like, of time. many vulnerable groups would have to wait for a very long time to get the first dose of the vaccine, because you would have to wait for everyone to go through both doses. So we do know that the first dose does protect quite a significant amount of protection, even though not as full as the second dose. It has been studied that that gap of 12 weeks is still a pretty safe gap, and that's what the public health announcement is. And that's pretty much all I can say. It would be lovely to live in a world that everything is there and we can all go at the same time, get the doses, get the second dose at the right time. But obviously that's not the case. And we have to bear in mind that we're actually quite privileged, because we are, one thing that we have got actually right is the vaccination program. We're doing quite well. Okay.
The other question is, and I know you're not a virologist. We don't know how this is going to go, but people are asking if when they do get the second dose, do we have any idea of how long it will last? Will they be protected for life? Will they have to get it like the flu shot every year?
Well, actually, that virologists don't know either. So we still don't know how long the immunity lasts for. And it is something that will be monitored. As I said at some point, I don't know if I was cut at that point, we will all be taking part in a very, very large experiment. And that's a good thing. But we still don't know how, exactly, we still don't know how long it lasts for. I think the idea that you get immunity that lasts for life is actually quite unlikely. And as far as I know, most people think that it's going to be something that will need boosters, whether it's once a year, like you get your flu jab, or less or more often. But the quick answer is that we don't really know how long it lasts for. Being a lifelong immunity is actually quite unlikely. Sorry.
Okay. And the next question is, if I get a choice in the rare thing, which vaccine do doctors recommend?
Well, this doctor recommends whatever you can get your hands on. And also, it's quite unlikely that you will get a choice. So yeah, most of the times, vaccines given in the community will be AstraZeneca. Most times, vaccines given in hospital might be the Pfizer, simply because of the storage and the very low temperatures that the Pfizer requires. But having said that, I know that either vaccine has been given in both sides. It's quite unlikely that you will be given a choice.
Okay. And I think people are worried about Moderna being given approval to be used, but it hasn't yet. And they were asking about the efficacy data for that. And do you recommend the Moderna being used whenever?
Sorry, it has been given approval.
Yeah, so it has been given approval, but it hasn't been you administered.
Given to rolled out.
Yeah.
Yeah. No, but again, the Moderna, like the other vaccines that have already been rolled out, is the data are extremely robust, very large trials, and the efficacy is more than 90%, 93, 94%. So again, the Moderna, like the other two vaccines, has been quite robustly trialed. So it's.
Yeah. Okay, somebody is on this and they took over our call. So whoever has an iPad, please mute. The next question is, and this is from somebody, I guess, who've had a flu jab and they become quite ill and they have nosebleeds. Do they expect the same to happen with the COVID vaccine, and should they have it?
Obviously, I don't know. I would suggest that you have it. Having side effects that last for 2 weeks and having nosebleeds is not something that has been widely reported. But of course, you can imagine that different people react in different ways. So I cannot exclude it. My advice would still be to have the vaccine.
Okay. And the last question for this section is, I have had the pneumococcal vaccine in 2017. Should I have this vaccine too?
Yes, it's completely different. The pneumococcal protects you against pneumococcus, and you should have it every 5 years. So you need another one in 2022. And this is against COVID. It's completely different. Yes, you should have it.
Okay, so we've received, so that was the kind of general questions. I'm now moving on to the pediatric cases that we got a few questions about. One of them was, are there any guidelines for children with thalassemia major and thalassemia intermediate on receiving the vaccine?
So I don't look after pediatric patients, but I have consulted colleagues that do look after pediatrics and sit in the National Hemoglobinopathy panel. The guidance is not crystal clear, let's put it that way. Generally speaking, we know that pediatric patients with thalassemia or otherwise are very low risk in any case for developing severe complications from COVID. There are always some extremely vulnerable groups within those groups. So for example, if you have the child that does have severe iron overload and so on and so forth, they would constitute an extremely vulnerable group within that sort of situation. And the guidance is that those children probably should have the vaccine. That is complicated a bit by the fact that the licensing of the vaccines is for 18 and over. So people will still, there will be that sort of confusion as well. And there is also a bit of, there's not a lot of clarity for that group between 16 and 18, where you can have some, where between 16 and 18, you're not exactly pediatric. After 16, you're not exactly pediatric, you're adult officially, but the vaccines are licensed for 18 and over, and there is still a lot of debate. But to try to make it a bit more simple, most children with thalassemia or otherwise will not be in any case priority, probably will not be offered vaccination, except for children that are considered extremely vulnerable, and within the context of thalassemia will be children who have suffered or are suffering severe complications as a result of their thalassemia, and it's probably going to be on a case-by-case basis rather than an umbrella sort of guidance, if you like.
Okay. And the one question was, how does a new variant of COVID impact children? I think people saw some information on the internet about children becoming extremely well with some kind of systemic inflammatory illnesses. Will this affect people with thalassemia?
So when it comes to, these are three different questions actually. Yeah. So when it comes to the new variants, they do not affect children in any different way than they affect adults. So we don't have any reason to think that they're in any way better or worse. So it's the same as with adults. When it comes to the post-inflammatory syndrome you were talking about, that has got nothing to do with the variants. So okay. Any strain of COVID-19 can cause that hyperinflammatory syndrome. What has to be emphasized is that it's extremely rare. It is extremely, extremely rare. And I am not aware of thalassemic children having developed it, and it has to be published, and I haven't heard anything about it. But either way, it is an extremely rare complication of COVID-19 in children. And that's the only concern about COVID-19 in children, because we always say that COVID-19 really doesn't affect children. They're doing asymptomatic. And that post-inflammatory syndrome has been put forward, has gained more publicity, if you like, because it is the one thing that can happen to children. Nevertheless, it is extremely rare.
Okay.
And
And
nothing
is
to do
there
with
any
the
kind of signs that parents should look out for in case this is to occur on the rare on the rare occurrence? In terms
Sorry,
of,
say again.
is there any kind of things they should, is there any kind of signs that they should look out for, like symptoms like rashes or bloodshot eyes or anything, if those things happen, that they should seek medical attention right away that you know of? On the rare occurrence.
As you always advise parents, is if you see something that you're not comfortable with, you seek medical advice. If you're talking about the post-inflammatory, the pediatric inflammatory syndrome, that is something that does manifest itself quite severely. So touch wood, if anyone develops it, parents will know.
Okay.
It's quite important to keep the things into perspective. That is something extremely rare.
Okay. And this is now over to the adult patients with transfusion-dependent thalassemia. How soon after the vaccine can I have my transfusion? And what if I'm symptomatic?
I did see that question. I would like clarification what we mean by symptomatic. Symptomatic,
so, symptomatic
because
in
of the transfusion, or symptomatic after the vaccine?
After the vaccine.
So in any case, one can have the transfusion at any point, after the vaccine, before the vaccine, because it's possible that after the vaccine you might feel a bit fluey. You may want to not schedule your transfusion for the next 2 days. Not that there is a reason, not that it's a contraindication, it's just for your own comfort. So you might want to schedule your transfusion and your vaccination not to fall within 2 days, so that you're not feeling unwell when you go to have your transfusion. But it's not contraindicated. It's not going to interact with the vaccine. It's not going to make things any worse. You can have your transfusion at any point.
Okay. I think somebody just commented that they had their first vaccine on the day of their transfusion, and they had no problems at all. Thank you, Rosina. The next
no. As I said, it's that the first day or two after the vaccine, you might feel a bit run down. So you may not want to go out that day to have a transfusion. That's all. And if you can sort of rearrange it, that's fine. But there's no actual contraindication. There's no risk. There's nothing like that. It's just a matter of comfort.
Yeah, and I think what they were concerned with some of the questions is that if they had a fever, for example, and they were worried about whether it'd be seen as a transfusion reaction, and that's why I think what you're saying is probably give it 2 days and then.
Yeah, if you can, but again, if you had a fever before you start the transfusion, again, it's not going to be. It shouldn't be considered a transfusion reaction. But those are, in a sense, details. I would say that if you can schedule your transfusion to be 3 days after your vaccine, even better. But if it cannot be accommodated, then by all means go and have your transfusion, and it's not a problem.
Okay. The next question is about antibodies. And I think somebody had swine flu before and became very unwell with that and got antibodies from that, and it was very difficult to get blood. And I think people are concerned with these antibodies. Will these antibodies show up in cross-matching samples, or do they have to go through a hard time before? And I'm not sure. Dimitri, if you heard that, it's stuck.
So me. I did hear you. Did you hear me? Can you hear me now?
Yeah, I can hear you now.
Hear me?
Yeah. I can't hear you anymore.
Can you hear me? So the antibody, sorry, from you.
I can hear you now. Okay, so there's like Murphy's Law, I guess. Things don't always work out. Dimitri, right now I think it's frozen. The next question. Should we go on to that?
Yeah, I mean, the question I was trying to answer earlier was about the antibodies, wasn't it?
Yeah, that's right.
So what I was saying is that when we talk about antibodies, we talk about allo-antibodies, so that antibodies we form against transfusion. The antibodies we form with a vaccine are antibodies against the virus. And of course, you have to bear in mind that we have millions of antibodies against different infections we've been through our lives anyway. So that doesn't increase your risk of developing new antibodies that will hamper. Does that answer the question?
I think so. I think people are like, so the other question we got was somebody who had swine flu and apparently developed some really strange antibodies to that. And they said, I don't know if this is some other thing, but
that was the result of the swine flu, or?
Yeah, so that I think that was, so they had swine flu according to the question here, and they developed some antibodies to that they had to take a few days to find blood. I'm not sure if it was due to that or was it due to.
That I don't see any risk from the vaccine in developing new antibodies against red cells. And when it comes to the question whether it would be picked up on cross-match, yes, it will be picked up on cross-match, because the cross-match immediately tells you whether the blood is compatible or not.
So I think.
But I think the likelihood of, you hear me?
I could, yep.
Yes, you can?
I can.
Good. So the risk of developing new alloantibodies as a result of the vaccine is very, very small indeed.
And the cross-match will pick it up. And I think that was the question.
And the cross-match would certainly pick it up, yeah.
Great.
Sorry.
We have two more questions here. Will the vaccine interact with my iron chelation medication or any medication that I take?
No. Very simple answer, no, it will not. You should have your normal medicines and you should have the vaccine.
Okay, and another question is, I'm on anticoagulants and I've heard that I may not get the vaccine due to the risk of bleeding. Do I need to do any blood clotting tests before to take into them? Is that advisable?
No, it's not that you cannot have the vaccine. The vaccine is given as an intramuscular injection. So if you're on anticoagulants, you have more of a risk to bleed inside the muscle. All you need to do is just tell whoever gives you the vaccine, and to know it yourself, to apply more pressure for longer. So if I have the vaccine in my muscle, I will press a bit and that's it. If you're on anticoagulants, you have to press for 10 minutes hard. That's it.
That's easy. Great. We have a question about if I've had my spleen removed, should I have the vaccine? I think we know the answer.
You have one extra reason to have the vaccine. Because if you have your spleen out, you become more vulnerable to infections. So the more vulnerable you are, the more important it is to get protected against any other infections. So you have one additional reason to be vaccinated.
And we have a question. I know we've gotten this question quite a lot from patients who weren't classed as extremely clinically vulnerable. And I think their concern is, when will they get the vaccine? And is there any chance that if they're up the list?
Yeah, go ahead.
And is there any chance that they can move up the list?
If they were not classified as extremely vulnerable, they will not be transfusion-dependent thalassemia, I take it.
No, so they are transfusion dependent. So the list, only a few patients, like a minority of our thalassemia patients with who are transfusion dependent, were categorized as clinically extremely vulnerable. I think it was an age factor. They looked at over 50s and iron burden.
Yeah. And the short answer is that you cannot do anything about it. I know, just anecdotally, I know from some of my patients that they called their GPs and they asked if they can be moved up, and they did. How did that happen? I don't know. But generally speaking, the criteria are quite sort of fixed, if you like. So it comes down to the individual to negotiate with their GPs. I don't have anything more to say to that.
So I think it's the art of persuasion. So right now, I think people with thalassemia who weren't asked to shield, but are in category 6, I believe. And according to the government's guidance, they should receive their vaccine in April.
Yeah. Did April or May? I can't remember, but yes.
Yeah, I think it was May 4th for the over 50s and above, but that's category 9. So let's say April, people.
Yeah, no, I don't think you can. I don't think you can bypass those rules. But sorry about that. But sometimes one has to be alert, because sometimes, especially with the Pfizer, because the Pfizer vaccine, as you know, needs to be stored in -70. And once it's taken out, it has to be given within a few days. And sometimes different vaccination centers might have the Pfizer, and they have extra doses that will go off, at which point they call anyone so that they don't waste doses. So that's something to bear in mind.
Okay, I've seen somebody who is clinically vulnerable who said they haven't had their vaccines, and I have to say, I'm classified as that too, and I called my GP and they sent me the link. I booked in and I had my vaccine, so I think you should contact your GP and follow it through that way.
That's what I was saying. So as I said, anecdotally speaking with my patients, I know that some who were tier 4 jumped up to tier 3 after having that sort of private negotiation, but I cannot say anything more about it.
Yeah, and just for some, I've heard of other patients who were not classified as that. They call their GP, and usually sometimes they have spare doses that if they don't give it to patients, they have to be discarded. And the GP, so I think there's a list as well. So please, so as Dimitri say, contact your GP because you might be able to get it.
You know, and as I said, especially with the Pfizer, that is often the case, that they have a batch of doses to be given, and some people don't turn up, and those doses will go off. So then they will basically jab anyone who's walking outside the practice at that time.
Okay. And I think somebody asked a question that they have transfusion-dependent thalassemia and they don't have a spleen, but they're not in category 4, they're in category 6.
Again, I cannot. These are all guidelines for Public Health England, so I cannot comment on that.
Okay.
Generally, splenectomized patients should be considered high risk, but that's not always the case. That's policy making, so I cannot really comment on that. All I will say is what we said earlier: speak with your GP, because you might find that there is some wriggle way there.
Okay. And I have to say, like, when the guidelines came out, initially splenectomized patients were listed in as shielding, and then they removed it. So the government is, I mean, we can't really comment on them. Okay.
No, we shouldn't.
The non-transfusion dependence. Well, non-transfusion dependent patients receive the vaccine, like within your trust, for example, your thalassemia intermediates, do they receive the vaccine? Will they receive it in category 6, or when will they?
No, they are not. If they're not transfusion dependent, generally they're not considered high risk.
Okay.
And quite understandably so, because they're not. So it will be more age-based, as with the general population.
Okay. The next question, the next 3 questions actually are on fertility. And I note that you're not a fertility doctor.
No, but it is an interesting one. So, do you want to read them out? Yeah.
Yep. How does the vaccine affect fertility? Does it make you infertile?
No. So I think so. As I'm sure you all know, there are lots of conspiracy theories and lots of concerns out on the internet. And in a way, it is easy to be very dismissive about these things. And fertility, in a sense, it's the mildest. There are theories about microchips and that the vaccine contains fetuses, all sorts of things. It's easy to dismiss them, but they all start, usually they derive from somewhere. So when it comes to what we have to make a distinction is between fertility and the risk of miscarriage. So fertility means your ability to conceive. Mm-hmm. And of course, there's nothing to suggest that there is anything that would cause issues with fertility. The reason why this sort of theory has come about, or this concern has come about, is because we know that the vaccine is against that spike protein of the virus, which is the protein at the surface of the virus that helps it latch on the cells of our nose and our lungs, and that's how the virus gets entry. And there was a misconception that that protein may have something to do with another protein which helps the placenta stick to the uterus, called synctin. There is no connection between the two, and let alone that even if there was, that mRNA that comes in with the vaccine gets removed within a day or two. So there is no issues around that, let alone fertility. So there are no concerns about fertility at all. There is nothing to suggest that it causes infertility. You don't have to go too far. It's a new vaccine. To talk about fertility and then issues with fertility is something that you would only see in the future. So of course, there is nothing to suggest there are any concerns about fertility, and there is no reason why it would cause any problems with it. The rumor has started from the worry about not fertility, but miscarriage, and that again is completely unfounded. It was just because of that wrong link between the two proteins. Okay. Doesn't make sense.
It does. I hope it does for everybody else. Can I have the vaccine whilst receiving fertility treatment?
Well, that's one thing I didn't say to begin with, that I'm not a fertility doctor either. I would have thought that yes, but I think that is something to discuss with your fertility doctors specifically. I can't see why it would. So it's not generally recommended for pregnant women, simply because pregnant women were not included in the studies, as pregnant women are always excluded from every study for anything. But the recommendation is that pregnant women who are vulnerable should still get the vaccine. And we have many patients who are pregnant and they are getting vaccinated. So I can't see why it would be different where you're not even pregnant yet, you're just undergoing fertility treatment. But I think that's the safest thing is to consult your fertility team.
Okay. And the next question, I know that you are not a fortune teller, but will the vaccine affect the future health of my unborn child?
No, it will not. If anything, what we do know is that the antibodies you form against the COVID virus do pass through the placenta or through the breast milk if you have a baby. So if anything, it can be beneficial because it will offer some protection against COVID to the baby, but nothing to suggest anything that would be in any way harmful.
That's great. And the next two questions are about carriers. So somebody said, as well as being a carrier of thalassemia, I'm a carrier of MRSA. I didn't know that was a thing. And I have other issues like atrial fibrillation. Do you think this will interact with the vaccine? Should I take it when it's offered?
No, it will not interact with the vaccine, and you should get it when it's offered.
Okay. Very precise answer.
So sorry if my answers are sometimes very sort of simplistic.
No, I think we need that sometimes.
Some answers take long to explain it. Something. No, you should get it.
Yeah, I like that answer. Is there any scientific evidence about whether alpha thalassemia minor increases the risk that COVID infections can become severe and life-threatening? And I think this is alpha and beta. With regards to being a carrier.
When we talk about minor, are we talking about trait, alpha trait?
Trait, yes.
You don't mean hemoglobin H?
No.
No, alpha trait, you are a normal, you're not a patient, you don't have thalassemia. So yeah, there is no evidence that COVID affects those individuals any more severe than anyone else.
And as you mentioned it, and let's cover it, hemoglobin H disease. Do you have any?
Well, hemoglobin H is a very variable condition. It can range from people who never need a transfusion and are very well and keep very good levels of hemoglobin, all the way to people who are transfusion dependent. So it's not the same for everyone. So it does depend on the risk, whether they are vulnerable or high risk from COVID, will vary from one patient with hemoglobin H to the other. But when it comes to the vaccination, there is no all patients should be vaccinated. If they are transfusion dependent, then they should be even more so, one more reason.
Okay, that was the end of questions that we had in the list. Another question that I saw in the chat was about carers. Do you know if carers are being offered the vaccine? And
as far as I know, I think I don't know is the quick answer.
Okay.
I think there has been quite a lot of sort of noise around it, and carers asking to be offered the vaccine. And I think that there has been, through that sort of consultation with primary care, carers have been often offered vaccine if they are carers of particularly vulnerable people. So carers of people who are, very ill or have many severe comorbidities. But I don't, as far as I know, carers don't get routinely given priority for vaccination.
Okay, and I know we got some information from one of the patients who are on the chat, and they said carers, like as you said, clinically extremely vulnerable. The carers, if the carer is the sole provider for the house, and you depend on them, you have to make sure they're registered with your GP. And I think you'll be offered it then, but not all carers will be offered it. You have to be financially responsible for the person who is clinically extremely vulnerable. And that's what. Teresa, have I missed any questions that's been on the chat? I can't multitask as well as I think.
No, you're fine. You've covered all the questions on the chat.
Great. Dimitri, would you like to say anything? I'm very grateful, and I know all the patients who are here are too.
It was a great pleasure. I'm really sorry for my connectivity problems, but we got there in the end.
We got there. I do have one question for you, actually, before you.
Sure.
Did you have the vaccine?
Oh, I had my first dose 3-4 weeks ago, the Astrazeneca. And the first couple of days, it was as I described it. So the first couple of days I did feel fluey. I was having, the first night I was having chills. But that's it, paracetamol, and that was it. Okay. And all that made me think about my second dose is to book a couple of days off work so that I can enjoy my flu-like symptoms. It didn't put me off, let's put it this way.
Great. I think that's all that we have. Thank you again.
Before we go, can I ask everyone to put their cameras on? We would like to get a group shot for social media, if it's okay with everyone.
But Dimitri, like, we are very impressed. I think you are leading the way in all the social media things. I think there's points we need to take to up our social media game that we learn from you.
If you told me a month ago anything about social media, I would be laughing. I still have no idea about social media, but different times require different things, and this is it. The vaccination is really our way out of it, and I'm just fully aware that there is a lot of concern. I'm sure you have heard that the Hindu population are concerned that it contains beef. The Muslim population are concerned that it contains pork, which of course it contains none of those things. And anything that hampers the effort to vaccinate it's quite important to actually get the real facts out there and the real information and convince our patients to have it.
I know, and it's really amazing how easily people see things on a Facebook thread, and it resonates with them and they think,
Well,
guys, I'm still waiting for my horns to grow out. I haven't gotten them.
Yeah, I know. But at the same time, one has to be a bit more understanding. Whenever that's a human reaction, whenever humanity faces extraordinary events, the first reaction is one, to be defensive, two, to be very suspicious. So that's not that uncommon. What's different now is that we have a very easy way of spreading information very quickly around the world. And what happens is, with conspiracy theories, something starts from an actual fact, which has got nothing to do with what turns out to be. And it gets magnified and distorted. It's like Chinese whispers. Someone says something here, by the time it reaches there, it's something completely different. And as I said, you hear things that are completely monstrous. You try to think, how did that come about? And then you go back and find where it possibly started. And then you see what it became. So it is important to get those facts out.
And I think what people need to remember is that we've been having vaccinations, like that's why we don't have tuberculosis. We don't have a lot of these things that we got rid of because of vaccines. So had it not been for that, I think we wouldn't even be here today, actually.
And neither is it anything new. Exactly. Not only how much we owe to vaccination, but also the fact that it's not something new. Vaccines we've had for more than 100 years. And as you say, they save millions and millions of lives worldwide. Sorry. So, yeah. And some people are concerned, there are a lot of people who are concerned about it being a new vaccine, which of course it would be a new vaccine because it's a new illness. And they are concerned about how fast it sort of got developed, which is a fair point. But we never faced a crisis like this, where globally everyone put their efforts towards one single target, where all the labs around the world pretty much stopped what they were doing and started focusing on one thing without any limitation of resources. There was a lot of money going into this. Never, ever did we have tens of thousands of people putting themselves forward to volunteer to take part in clinical trials, which now has happened. And at the same time, the pharmaceutical companies went into production before the results of the studies were out, so that when they do come out, if they are positive, they don't have to go into production there. The governments had bought in advance doses. So everything got very, very sped up due to the scale of the problem. And that's why we had the vaccine so fast.
And the approval body, they still did it as they usually.
And the approval bodies basically worked day and night, but they didn't scrutinize the vaccine any less than they scrutinized anything else. Both the MHRA in the UK and the European Commission and the FDA in the States, they went through the same processes, the same rigorous approach. They just really worked day and night.
Yeah, I think it's special. I think this is the first time that the world worked together and shared research.
Jokingly, I quite often say jokingly that doesn't show you how fast the vaccine got developed. It shows you how slow everything else happens.
Yes.
But yeah, it's the fact that it hit all the world. And it's causing millions of deaths, but also it's hitting the economy worldwide, bringing different problems. So all the world pulled together and didn't spare resources, and there were people working really around the clock. And equally, the public put themselves forward to take part in the studies, because if you don't have the studies, you cannot have the vaccines. So having tens of thousands of people putting themselves forward to volunteer and take part in the studies, that again is something very unique. Never happened.
We also, I know of some of our consultants actually, they volunteered to be part of the study when it originally started.
I have many colleagues who did.
Yeah, and which was fantastic. But yeah, I think that is it in a nutshell. I hope that we see you soon again and we can do this again.
I would love to. It was lovely. Thank you.
I hope you might regret saying that to me, by the way, but I have lots of witnesses.
I'm sure you will. I won't.
But thank you. I hope that you guys have a good evening and you enjoy the rest of your time.
Thank you very
Please
much.
remember to be safe. Don't be complacent now. You have to follow the regulations and the rules that are set. Do not, like, I've heard patients say, well, it's fine, like I could be outside. Please, please don't.
No, you can't. I agree.
Gabriel?
Sorry?
Gabriel.
Is he still here?
Can you hear me?
Yes.
Thank you all very much for attending. It was a fantastic to listen to Dr. Tsitsikas. So thank you very much for your time as well. And if you do have any questions, please contact the office and we'll do our best to answer them if you can think of anything in the meantime.
Dimitri, I don't know if you see the comments. Sorry, Gabs. Dimitri, on the comments, everybody says that we should give you a round of applause. That's
I blush very easily.
Sorry, Gabs.
But thank you very much.
So, guys, we will publish this on YouTube and we'll do a question and answer thing for our website. So look out for it in the next coming days. I hope we got to all the questions and I can't believe we did this in time.
We're very good, despite the connectivity issues.
Yeah. Okay. Anybody has any questions before we say goodbye?
A chance, just unmute yourself.
Thank you very much, everybody. That was absolutely brilliant. I've been listening to loads and loads of COVID sessions like this because I'm Harrow Interfaith Chair and we're trying to get all our communities to, little focus groups as well. But we had a problem here with the Hindu community, as Dimitri mentioned, about all these rumors about beef and pork extracts. And we were at a point where only 25% take up, then 50%, and now you only got 1% who are hesitant. And I've told them, stop it, just get a move on, guys. Now we're having a problem with our Caribbean population, 20%. I'm looking very hard, long and hard to see if I can find some celebrity person, who they trust and they love, and they'll probably listen to more easily. But our CCG approached me a couple of nights back, say, one of the doctors there. They're doing a project with two medical students from Imperial College, and they wanted to get videos made up about various different communities, the faith communities in Harrow. We've got quite a number of them here, and some feedback from them, those who've had the vaccine or those who've heard about it and what are their feelings. They're going to roll that out to try and persuade the staff at the local authorities, CCG, and also perhaps, down at some of the other places where they're resisting taking the vaccine. It's also they'll give it out to members of the public. Once we've seen the actual recording, we will then be allowed to have a look and say, is it okay to release it? And we'll do that. And I just done mine this morning. So I'm keeping my fingers crossed that we do something good here. And thank you so much. I feel so encouraged by all the things I've heard today. So thank you.
Dimitri, again, you're the star here.
Joanna, you're very good.
No, I'm not. I am just
good.
one of the trustees that were here and decided.
Very good. Don't put yourself down.
So no, I don't know if you know, but there is a celebrity video of all the BAME celebrities who've gotten a video. We can send that to you.
Please,
and I'm like Dimitri's biggest fan here, but he's done a video with his his patients with sickle cell who have received the vaccine, and they've talked about it too.
And we're making now one where we have the patients actually being vaccinated. I think doctors and specialists can say many things, but unless patients see other patients or hear other patients, I think the most impact comes from patients talking to patients. Mm-hmm. And that's what we did to begin with, where we had patients talking about the vaccine, and now we're making another video where it's patients having had the vaccine and other taking photographs of themselves or actually video clips of themselves as they get jabbed to say, here I had it and I'm fine. Well, and I think that is what more of a difference.
I also find getting our focus groups within our own communities, you know, getting small focus groups, making them understand what it's about, because I'm trying to do 2 jobs at the same time in my volunteering, that I'm also trying to get them to do the census, 2021 census for our services. And I'm mentioning the census here because the Greek community, a lot of our thalassemics are Greek and also Indian and whatever else. They should also join in and say what sort of, you know, things about their life. It'll help to make some of the services for the next 10 years.
Well, I hope you get in contact with us because we're doing patient stories. So you'll get a lot of that from our website. So
Lovely.
so,
Thank you
I'm
so
going
much.
to put you on to Teresa, so you'll find it. But
Thank you, Teresa.
And that's fine.
I think we do, and we'll send you that. So no, I don't know if you follow our Facebook and stuff, but the video with the BAME communities, 2 of our patrons are actually on it, Nida Wardia and Adil Ray.
Oh, really? I do know Nina. I've done a thing with her some years
so
back in Rayners Lane. Yeah.
Okay,
No,
guys.
I'll email you a link to that as well.
Yeah, please do.
Guys, I think that is it. Dimitri needs to go and spend his time with his family.
Right. No,
So,
well,
Thank you again.
thank you very much for
It's been
having me. It was a real
absolutely
pleasure.
Very nice. Very nice. Thank you so much.
Thank you. Pleasure.
Bye. God bless.
Guys.
Bye-bye.
Bye.
bye.